Pfizer came out with its study indicating their vaccine has 6 months immunity, but questions remain. Here with us now is Dr. Cole Beeler, infectious disease expert from IU Health. Dr. Beeler, great to see you.
Yeah, nice to see you again.
So we have this study out, and first I want to get your thoughts on it. 6 months immunity.
Yeah, I think this is great to see. It's not entirely surprising because we've been seeing this clinically, right? We've been seeing the patients that we've been vaccinating a while ago do just fine throughout this interval. So it's great to see that they're going to release something on this. It is just a press release, so I would like to see the absolute numbers. But this is great news. This is what we want from a vaccine. The durability here is actually way above what I thought it would be before the vaccine was out.
Wow, really? Okay, that's interesting. Can I get your thoughts on what you we always want to be cautiously optimistic, a phrase I love that I've gotten from you. What were your thoughts beforehand? I mean, if you're willing to share.
Sure. So coronavirus immunity just naturally is probably, 3 to 4 months that it lasts, and then you can start getting reinfected. The vaccine showing 6 months is actually probably supporting an extremely durable immune response, more than would be expected just by a common cold virus, which is exactly what we need in order to have long-term herd immunity from the virus. So this is extremely encouraging. But the big thing here that I think is even bigger than the 6 months is the fact that the vaccine seems to be working in areas where there is a predominant risky variants being spread, and that is South Africa. The fact that the vaccine had 100% reduction in severe disease there is the main take-home point for me, because I think the fear of the variants right now is still dictating a lot of the policy across the United States from the CDC, from local and state health departments. And if the vaccine works against these variants just as well as it works against non-variants of concern, then we're looking at a very different world moving forward. So I think this is the first real major sign that we might be able to liberalize even further and faster if this actually ends up being tested in a little bit of a higher amount of people.
Okay. And Dr. Beeler, do you have any idea if they base this on the number of antibodies that remain in these vaccinated patients, the concentration, those T cells, other sort of markers that indicate protection from these vaccines?
Yeah, it seems like they're looking at clinical effectiveness. So they're watching the patients who have been vaccinated to see if they get infected, to see if they go to the ICU, to see if they die, which is what I want to see. And I think that's part of the problem with a lot of the data that's out there with the variants right now, is that you're only looking at antibody to presume that the vaccine might not work as well against the variants. But really, the immune system is extremely complex. There's multiple arms, and all of the arms could potentially contribute towards eradication and sterilization of the virus. Because of that, we really need to see studies like this in real life where people who have been vaccinated are doing just fine. That's what we're trying to get to, the vaccine as a correlate for protection and avoiding the hospital.
That's interesting, right? Those outcomes send a really strong message to people. Less hospitalization, 100%, and less death. I think that's really what we want to know, okay? For now, okay, as long as we have antibodies, maybe that's sort of course, contributing to it. But like you said, let's not go to the hospital. Let's not, pass from this if we do not have to.
You're totally right. What I would just say to drive it home is that the antibody is great to look at, but it's only one part of the picture, and we really need to see what happens to people in the real world. I almost don't care about anything else. If people are avoiding the hospital, they're not getting sick, they're not dying from the virus, then we need to start reapproaching how we're doing policy around this.
Wow. That's really right. Because for so long it's been about, and we need to, of course, science, we need to know about that. But as you mentioned, Dr. Beeler, the immune system is so complex. There's so many factors that play into why someone would have protection against this virus. So my next question is, okay, this sample was small, and it was, like you said, the press release. We don't have maybe the full study and the full sort of information that we have, but still, it's encouraging for maybe people to get vaccinated. What are your thoughts on that?
Yeah, I think that's exactly right. It needs to be, it would be great if we saw this duplicated across other vaccines. It would be great if we saw larger numbers, longer amount of time from even Pfizer. And just more people in different countries that could add to this data set. But you're right, this is extremely promising at this point in time. It's making a lot of sense right now to push as many people towards vaccination as possible, because this is the light at the end of the tunnel. We are there. It is open for everyone who is 16 years and older. It's really hard to come up with an argument why you wouldn't get this vaccine, and people who are exempt from it really are relatively few when you look at the vaccine studies. So our best chance to protect our ability to get back to normal, not only in Indiana, but in the United States, and do so safely so that no one's dying, is through the vaccine.
Yeah, right. I mean, and speaking of vaccination, how are we doing in Indiana? I mean, are people more willing to get the vaccine and past? I mean, I think I did read some data that nationally that people are becoming more open to getting the vaccine when the numbers are up. So how are we doing in Indiana in terms of vaccine and hesitancy, and maybe percentage of people, the change in percentage of people willing to get it?
Yeah, so I know that we were sitting about at 70% of the Hoosier population that was willing to get the vaccine. That's been very slowly rising. Our vaccine uptake or administration has been increasing around the same slope as it has nationally, even though we have been limited by vaccine availability. But we're vaccinating tons of people every single day. The Motor Speedway as a vaccine option is extreme. It's drive-through vaccination, and you stay in your car, and it's one shot if you get the Johnson & Johnson. For the age groups that we're pushing right now, Johnson & Johnson makes perfect sense. It is extremely highly efficacious against the endpoints that I think are the ones that we need to worry about, which are hospitalization, severe disease, and death. And that's what you want. You want to get in and out. You want to get back to your daily life. And I think that the vaccine, being able to be delivered in such an efficient manner, is our way to reach out to Hoosiers and help it make it as easy as possible for them to get vaccinated.
Mm-hmm. And then, I mean, in the comfort of your own car, I mean, this is the way. It's like nice and quick. And even if there are kids in the back or people in the back seat, you bring 4 people, you got 2 nurses or 2 people who can administer it. And then it's like, you're out of there.
Yeah.
And speaking of this vaccine, specifically with the Johnson & Johnson with the 1 dose, how long do we need to stay vigilant? I mean, I know we really want to stay vigilant. I mean, at least I do. I'm going to wear my mask until, I don't know, when I feel comfortable not wearing my mask, despite, the advisory today that is out now.
Right.
But how long should these individuals who get this vaccine remain cautious until they are fully vaccinated? I heard from another doctor 4 weeks.
Yeah, so it's usually 2 weeks after your last dose of the vaccine. So in a 1-dose series, it's 2 weeks after your injection. In a 2-dose series, it's 2 weeks after your second dose. And that's where you're going to have probably your maximal protection. And then from that time period, it's probably going to degrade over time. But that degradation rate right after this Pfizer report is probably a lot slower than we thought it would be. And you're going to have protection for a lot longer than protection even against the common cold. So that's very, very encouraging, I would say, to starting to approach liberalization of policy like we're doing in Indiana right now. Now, you're right. I still wear a mask. I do it not because I'm scared of being infectious and not because I'm scared of catching the virus. I do it as kind of a message to the community that I'm trying to protect you. You don't know if I've been vaccinated, and I do it in order to try and make people feel safer around me. Do I think that masks are necessary outside? I don't. I really don't see an issue with wearing masks outside. If it makes you feel more comfortable to wear a mask after you've been vaccinated, cool. Do what you need to do. But really, all the data is starting to line up and suggest that the vaccine is efficacious. The vaccine can help us be protected when maybe we aren't able to avoid distancing and maybe we aren't wearing masks. So as more and more studies come out showing this vaccine, I expect these to fall like dominoes, these other infection prevention motifs that we've been suggesting throughout the summer. Hopefully throughout the fall, we'll get more and more information that suggests that we can get back to what life looked like in 2019.
Wow. Really strong and encouraging words that you have here, Dr. Beeler. And I'll just say, circling back to, I mean, I have not personally been vaccinated yet. I'll be vaccinated in maybe a week and a half, my first dose of Pfizer vaccine. And then,
Awesome.
When I'm so grateful.
I'm excited for you.
I'm sorry?
I'm so excited for you.
Thank you.
Yeah.
And I think that once that sort of timeline in which I will not, it's not out of being fearful of catching the virus, but I think it's really important that we have the masks on just to, you know, right, we don't know if someone is, if I've been vaccinated or not. And sort of conveying to the public that this is really still important that we do this until I don't know what it looks like in 2019. So I'm with you on that is what I'm saying.
Yeah, I think that having a strong urging for masking is entirely appropriate until we get to herd immunity. And a very important caveat to what I'm saying is that cases are getting worse in Indiana right now. We
Yeah.
have more COVID now than we did last week, and the rate's going up. And to be honest with you, it's probably because of the UK variant that's spreading across Indiana. And what I suspect is it's probably related to one, travel, and two, just a younger age group that started to say, okay, it's nicer outside. I'm going to start mingling again because everyone who's been vaccinated is mingling again. Any sort of optimism is really the foundation of it is the vaccine. If you haven't been vaccinated, nothing has changed. And I still have a very pessimistic attitude for COVID. If you've gotten the vaccine though, even if you don't even completely buy into anything that I'm saying, the vaccine provides a very strong peace of mind that you have the maximal tool that we have available to us to protect yourself against infection. If you don't get the vaccine, then distancing, masking, washing your hands, staying out of crowded areas, those continue to be the best things that you can do for yourself and your loved ones to help protect them against the virus.
Well, that's, just going off of what you're saying in terms of the younger population. I mean, there is sort of an uptick, and we're seeing that these individuals are getting infected more. And it is that sense of, I don't know, I don't want to make a sweeping statement, but right, I've been seeing those cases in that demographic.
Yeah. Yeah, I mean, I think nationally we're seeing that, and some of the states that are, a little bit earlier on their upslope, like Michigan, are seeing it predominantly in the younger age groups that haven't yet been vaccinated but have started returning back to normal life. So, I mean, we're in this gray area right now that's really hard to know what to do from a policy perspective. And it's hard for me to know how to talk about this, right? Because for those who have been vaccinated, I think that there is a clear light at the end of the tunnel. I don't see a whole lot of benefit in masks, especially outside. I think that distancing is probably optional if you've been vaccinated and you're around other vaccinated people. But the fact that there's still this group that's around that's unvaccinated and vulnerable and could potentially have a bad outcome from the virus, and a certain amount of people in the older age groups that are at risk from maybe not mounting as profound an immune response or aren't able to get the vaccine because one of their underlying medical conditions, to me says that we're still in a holding pattern with masks and kind of making sure that we're still recommending this until we get to herd immunity. And we'll know we're at herd immunity when the cases are dying off, when we're not having cases every single day. Mm-hmm. But when that is going to happen is really hard to know. I'm hoping that it's going to be by fall.
Okay. And well, going back to that gray area, I think that's a really interesting way that you put this holding pattern, this gray area. And then also the herd immunity. I mean, I think we're at 30% nationwide. That last that I read. Is that fair to say, or?
Yeah, that's actually the number that I was going to guess. I think that's the last thing that I saw too.
Okay.
We're at about 30%. And I mean, we're getting higher every day, but it's a slow process. We also have to factor in the fact that people who are naturally infected with the virus are going to contribute to herd immunity. We don't know if they contribute the same way as getting the vaccine, but I suspect that they probably do. So one way or another, we're going to be getting there throughout the summer. Either you get the vaccine and you do it the safe way, or you get infected and you do it the dangerous way. But I think we're moving in that direction, regardless of the direction people think that they want to go.
Wow. Dr. Beeler, last 30 seconds, your message to Hoosiers.
Yeah, I think the important thing is to really figure out ways that you can get your vaccine. Now it's open to everyone who is 16 years and older. There's multiple vaccination clinics. Be willing to drive, get whatever vaccine that you can get that's closest to you. That includes Johnson & Johnson, which is a one-dose series. I think it's a wonderful vaccine. The more people that we can get vaccinated, the faster we can get out of this gray area and can start changing policy back to 2019. And just as a personal aside, once I got the vaccine, even though I knew I was at very low risk for COVID, I very much felt a change in how I approached the world. Like I just felt safer. There was this mental change in me where I felt like my family was safer. I wasn't going to bring something home to them. And, even low risk, you feel this extreme relief once you get that vaccine in you. So I very highly recommend it.
Well, I'm glad that you felt that sort of lift, and I'm hoping
Oh,
to have that same lift when I get vaccinated. I think it's coming. I remember speaking to someone, and they were saying people were saying that is a it's a just hearing it around the phrase um, the freedom shot, but I would say it's the freedom from fear shot.
yeah, totally. Absolutely. And I'd love to talk to you after it, because I've been asking people, like, you don't think that a lot of stuff's going to change in your mindset, but man, after they get the vaccine, most people are like, I didn't know that I would feel this way. It just feels like it's a complete different world now.
Well,
And that's worth its weight in gold from my perspective, considering what the state has been through.
Well, Dr. Bueller, we are out of time, but that would be wonderful to have you back on to talk about sort of mindset of people after they've been vaccinated. So, and I just want to say thank you so much for your expertise, your insight. I know our audience always loves to hear from you. So, thank you again.
That's nice of you. Yep. I love talking to you. Thanks for the time.